Good evening, everyone. My name is Angela Giordano, and I'm excited to welcome you to this Falcon live chat on student well-being. In a moment, I will let my colleagues from the Health and Counseling Center introduce themselves, but I just want to go over a couple of housekeeping pieces before we get started this evening. First, just noting that your camera might be turned on, and you can feel free to click stop video on your screen if you would like to turn off your camera. Second, we have muted everyone's audio. So if you find that your audio is turned on, if you could please switch it off so we don't pick up any background noise while we're doing the presentation, that might be distracting for folks. And then third, feel free to type in questions as they come up into the chat box. So you'll be able to send messages to the entire group of us tuning in, and you can also send private messages as well. We'll have some time to answer your questions at the end of today's presentation. We've set aside some time. So we'll probably be sharing some information with you about our areas for 20 to 30 minutes, and then we'll get to answering some of those questions that come in. So on today's live chat are folks from our Centers for Health Counseling and Wellness. As I said, I'm Angela Giordano, working in the Office of Wellness and Health Promotion.
And I'm Margaret Fitzgerald, the Associate Director of the Health Center and a nurse practitioner.
And I'm Peter Forkner. I'm the Director of the Counseling Center.
So as we get started this evening, just talking about our three offices, we wanted to share our mission with you all, which is on the screen that you see here. So just kind of overall, our three offices work together collaboratively to meet our students' needs for physical, mental, and behavioral health. We do this with use of best practices in each of our respective areas and communication and collaboration that integrates our services across these areas for all of our students. So through the chat today, you're going to find out more about each of the three centers and what we do at Bentley and how we work together.
So again, welcome parents. This is Margaret Fitzgerald, and I'm just going to give you some information about the Health Center and the health requirements and insurance today. And the Health Center is located in Rhodes Hall, which is on the ground floor, and it's across from the Student Center. It's very easily visible and accessible to the students, and our phone number's there at 781-891-2222. The Health Center provides quite a bit of comprehensive services to all full-time students, regardless of what kind of insurance that they have. And we have an experienced nurse practitioners, we have a physician director, a registered nurse, we have outside physician consultants from Children's Hospital Adolescent Clinic, and we also have a nutritionist. We treat and manage many conditions, health conditions and minor injuries. We provide a lot of health education to students and information. We perform laboratory testing. We administer immunizations and write prescriptions and provide referrals to specialists if needed. Students are encouraged to make an appointment in our office as early in the day as possible. Same day appointments are usually available. They can also walk in and make an appointment. Anything urgent, they'll be seen right away, and they can always speak to us if they ask to speak to us. And I urge you, as well as parents, to call us if you have any concerns, and we'd be glad to reach out to your student or answer any questions. For emergencies or when we're closed, students can call University Police 24/7. They're all first responders and should call them and have this number in their phone in the event of an emergency. Would be 781-891-3131. Services in the Health Center are confidential for students, and no medical information is shared with anyone on the campus or outside of the campus unless they're experiencing a life-threatening emergency or they're not able to speak for themselves. The cost of the visits, there are no charge. We do not charge insurance for visits. Charges would be for laboratory tests. If your child were to need one in our office, we would send it out to the lab and the lab would bill your insurance. We will bill health insurance for immunizations if they're on the student health plan. Otherwise, you're given a receipt and can get reimbursement. We do have some immunization clinics running in August and in the fall, and those will be run by Osco Drug, who will bill your insurance. Prescriptions are, the student would be what a prescription copay would be, so that would depend on everyone's insurance. Our office hours, again, are listed here. We're open daytime, Monday through Friday. For after hours care, there's Newton Wellesley Urgent Care. They're open till 7 during the week and on the weekends. And we also use the Mount Auburn and Newton Wellesley Hospital Emergency Room, primarily the Newton Wellesley Hospital. And University Police is available to transport students to either urgent care on the weekend or to the emergency room if it's not a life-threatening condition. So students can just call them and ask to be taken there, and they'll come pick them up as well to those places. That's just to be used though for urgent care, not for routine appointments. I'm going to talk a little bit about student health insurance, which is required in Massachusetts for all full-time students, and you have to have a comparable plan under the state that meets all the requirements. International students are required to enroll in the Bentley plan through Blue Cross Blue Shield. Every year, students are billed for the insurance, and you need to waive every summer if you do want to use your own plan, and you have to show proof of other comparable insurance. So this is done every year, and it's done through Student Financial Services and is due by August 1st. So the sooner you do that, you'll be able to get that fee off of your bill. I would encourage parents to really look at your coverage, especially if you're out of state, and make sure that it is good coverage while your son or daughter is in Massachusetts and meets the requirements. And I know a lot of family plans now have high deductibles. This plan doesn't have any deductibles. It has excellent coverage. So I would just encourage you to talk to your own insurance company and look at this plan and deem which is would be the best for you. And it's also a really good time for you to sit with your son or daughter and go over insurance and how it works and what a deductible is and what a copayment is, and have them realize that if they do go to an urgent care or get laboratory work, they may have to pay for some of that if you do have a family deductible. So it's good to just get them familiar with that and understand how it works. There's also optional insurance through the university health plans, and their website is there, universityhealthplans.com. They have dental and vision care. Also through Student Financial Services, a tuition insurance plan is offered. And the websites for that information are above. And the tuition insurance would apply to students that have to withdraw from school in the middle of a semester for illness or unexpected accident or mental health conditions. There are some exclusions, so I would look at the policy, and approximately getting about $20,000 of coverage per semester costs about $500 for the year, just to give you an idea, but you can get less than that depending on what your needs are. Now I'm going to talk about immunizations, which are again required by the state of Massachusetts. All students should be fully immunized prior to starting classes and living on campus. So this is what we're working very hard on getting in this summer. Students need, the deadline for submitting was July 1st. I've listed what's required here. You can go to our website and read about it more and get that information there as well. Students have to log on to their health portal in order to submit the health information, as well as fill out their health history and a tuberculosis screening questionnaire. So once they log on with a Bentley short name and their Bentley password, they'll see their portal. And I have a picture on the next slide of what the portal looks like. When the home page is going to look like this, and it really does spell out everything that needs to be done step by step. And it's important to remember that with the immunizations, we not only need the document, but you have to manually enter the dates of all the immunizations, and then you hit submit. And it'll be a few days for everything to get verified by the registered nurse. But once it's been verified, this is where you'll enter all the immunizations and upload the documents. Once the information's been verified, then you'll be able to see on the portal if anything's missing. Again, that's a few days after everything's been put in so that the registered nurse has had time to look at it all. But if you go to the immunization page and hit what else is missing, that right there, that will come out and say what is still needed. Some students are in the middle of trying to get vaccines and have appointments later in July. As long as you can start submitting what you have, please do, and then you can submit the rest later. We are going to have an immunization health clinic for all undergrads on Wednesday, August 21st from 9 to 3. It's in room 255, the pub in the Student Center. So if you need any vaccines or need any TB screening testing done, please attend this. And I encourage all international students to be, prepared to go here. We will be checking when you're checking in, giving you the information on what you still need. The cost of the vaccines will depend on your insurance. With the school plan, they're covered 100%. And again, your insurance will be charged if you have it. So additional resources or information, I'd say, please, I encourage students to seek care when they need it. Don't wait. Parents are always welcome to call our office, and we'll be glad to answer any questions or see how we can help to get your student in for care. If you have any insurance questions, I've got the website there. Also at our website is www.bentley.edu/health, the Getting Started tab. And again, I encourage you to talk to your child about insurance and make sure they have their card. And if they could upload their card as well to the portal, that would be very helpful. And then I'd strongly consider getting the tuition insurance. Thank you. And there's my contact information. And then it's on to Peter.
Okay. Hi, everybody. Again, I'm Peter Faulkner. I'm the director of the Counseling Center. Counseling Center is located on the second floor of the Callahan building, which is probably most easily recognizable because it's above the University Police Station, so it's pretty easy to find. Our number is right there, 781-891-2274, and students can call that to make appointments or ask general questions. So at the Counseling Center, we have a number of staff. We have 6 licensed psychologists. We have 3 doctoral interns who come to us from other schools who are seeking their degrees in clinical psychology. And we also have a consulting psychiatrist who's on staff for 11 hours a week. So at the Counseling Center, we really do a number of things, but the way I like to phrase it is that I want all students who are experiencing any sort of level of mental health related distress to come in. I don't want students who feel like their issue is too small or their issue is too big to be seen by us. We have all of our staff are experts in college mental health and are great resources for when students are struggling. And so when a student comes in, they're able to come in for an initial appointment in which they speak with one of our staff, and that staff member will sort of take a history and get a sense of what's going on, and then be able to make recommendations going forward for what's best for that student to sort of get back to an optimal level of functioning. So if appropriate, we can provide short-term individual and group counseling. So Our model at the Counseling Center is short-term in nature. So for some students, we'll be meeting with them on a weekly or bi-weekly or less frequent basis to help them deal with whatever they're going through. We can do that on an individual level, but we also have a really successful group counseling program where we will run a number of groups each semester for students whose issues would seem to benefit from that kind of modality of treatment. We also have a number of skills groups in which we are able to teach students who are struggling with how to deal with stress and how to deal with strong emotions, to be able to sort of learn some techniques for how to deal with that. For some students, a short-term model of care really isn't optimal. And so if that is the case, we will assist them with finding services off campus that meet their needs, whether it's just their whatever they're dealing with is something that would require more long-term care, or maybe it's a specialized concern that would be best seen by a specialist. And we are very familiar with the providers in the area and are able to sort of work with the student to help them get connected with whatever they need. As I mentioned earlier, we do have a psychiatrist on staff for about 11 hours a week. And he's just there to for students who've never been on medication before and need to be evaluated. So for some students who are being seen by some of our clinicians and we feel like it's appropriate, we'll make a referral to that psychiatrist. But unfortunately, he's not able to meet with students who are already stable on medication. So if your student is coming in and is already on medication and needs a prescriber, unfortunately, that's not something our psychiatrist can help with. However, we are able to provide you with referrals in the area or help you get connected, or at least troubleshoot to figure out how maybe the current psychiatrist would be able to provide ongoing medication care. I do want to make sure that I emphasize that any student who's in crisis or having an emergency can come in same day and be seen by our staff. Now, it's always helpful to get a heads up, but certainly don't want people to hesitate if they're in crisis and they need to see somebody. So just walk right in or give us a call and we'll be able to sort of clear our schedule to make sure that that person is seen. So often students ask me, so what kind of concerns do you see there at the Counseling Center? And really, it's quite varied. In fact, some of it is mental health related and some of it's not mental health related. And in those cases, of course, we would help the person get connected with the appropriate office. But more often than not, for those students who are first coming to Bentley, we see a lot of students who are having that difficulty with the adjustment period. And we're certainly able to see that. We help students with stress, anxiety, depression, relationship or family concerns, alcohol or drug use, and occasionally grief. But really not limited to any of these issues. So please don't hesitate to have your student make a phone call to make an appointment if it feels like it's mental health related. Something I always like to emphasize is that our services are part of the cost of attendance, which means there's no additional charge. You don't have to use insurance. So students who might be concerned about that piece of it, they don't have to worry. They would just come in and we just give them some forms to fill out. That just to give us a better sense of what they're dealing with, but in terms of payment, there's no additional costs. Our services are confidential, which means that we're not allowed to release any records without the student's permission, not even to parents or family. Quite often I will have family call and say, oh, my son or daughter just called me because they met with their psychologist and I had a few questions. And unfortunately, in those cases, I have to tell that family member, I'm sorry, but I can't confirm or deny if that person's being seen there. And this can be kind of embarrassing because often you've just had a conversation with your student, but the truth is that we take confidentiality very seriously. So if we don't have a release on file giving us permission to acknowledge that that person's has been there, then we won't be sharing with that with anyone. So I will encourage you, if your son or daughter does come to the Counseling Center and they are comfortable with sharing information with you, that you sort of remind them that they can sign a release that would give us permission to talk to you. Of course, there are some cases where if it was an emergency and it was a matter of life or death or something like that, then yes, of course, we would reach out, but only in those extreme cases. I also like to emphasize that this isn't a part of the university record. This is a separate medical record. So we would hold that confidential. It's not going to become a part of any sort of, something that's going to follow the student after Bentley, other than what a regular medical record would follow a student. During the year, we're open Monday through Friday, 8:30 to 4:30. If the student needs to make an appointment, you can just call that number, 781-891-2274. Although we do have a policy at the counseling center that only students can make appointments. Sometimes we'll have family members call and ask to make an appointment. Maybe you know the student's schedule and we recognize that they're really busy. However, it is our policy, as we find that the more students, more often than not, if they're not the ones to make the appointment, then we're less likely to see them, and we want to make sure that our time is used most efficiently. And then again, there's our location. So some other things that the counseling center does, we do quite a bit of outreach. So we try to go out into the community and make presentations or do different types of events to decrease stigma associated with mental health and mental health help seeking. So for example, this fall will be our 4th Fresh Check Day, which is an event we hold on campus where students learn a lot about mental health, positive mental health, suicide awareness. It's a really positive event that students really enjoy. So we don't have a date nailed down for it yet, but it should be planned probably in September. And so we'll certainly promote that, but hopefully once people become aware of it, that they'll put that in their schedule to make sure they attend. We also do a lot of consultation, and this can be for any member of the Bentley community, including families. So if you're concerned about your student or another student and aren't really sure how to handle that, you're able to call and speak with one of our clinicians, or if your student's the one who has a concern about somebody else, they can make an appointment to meet with one of us, and we'll help guide them through any sort of mental health related concern. And so, we often have students who come in who are worried about a roommate or something like that, and we'll be able to talk with them and guide them through how to have those interactions.
Great. Hello again. So this is Angela Giordano from the Office of Wellness and Health Promotion. As you can see on this slide, we are also located in the Callahan building on the 2nd floor, so above University Police, and we are co-located with the Counseling Center, which is really great since, as I mentioned before, we definitely work together a lot across our 3 offices. Our contact number is on the screen, so that's one way that you or your student could get in touch with our office. I will also say that our office is staffed with 2 professionals, so myself and our Director of Wellness and Health Promotion, Jessica Greer-Trawa. And so on this next slide, you'll see an overview of some of the services, programs, and events that we provide to our campus when we're thinking about student well-being and health promotion and health education. Some of the topics that we either meet one-on-one with students, or we might be out in the community doing programs, events, skill building, opportunities to engage with our offices and areas. So some of the things that we do provide students for one-on-one includes individual health coaching. We can do group health coaching as well. So that might mean meeting with myself or Jessica to talk about integrating a new health behavior into your student's life. So maybe they're thinking about nutrition and navigating the dining halls on campus, and they're not really sure where to start, so they want some resources. So we can help them figure that out, set some goals together, and have some follow-up conversations along the way to help them feel like they're staying on track. They might meet with us for things such as sleep or exercise, or perhaps other health behaviors that they're thinking about putting into their life. Another way we meet one-on-one with students would be private consultations around substance use. So that might be alcohol, marijuana, or other substances. You'll also see that nicotine and tobacco cessation is up there. So we do meet with students if they are using either vapes or cigarettes and they're interested in cutting back or eliminating that use. We can work with them on that and set up a plan and provide them with some resources in collaboration, I think, across our 3 areas as well when we think about that topic. So if you think your student might benefit from one of those appointments, definitely encourage them to reach out to us if they're considering something, or maybe even just midway through the transition in the fall into the semester and they're like, huh, this isn't going as well as I thought, or I really want to think about this or figure out what resources are available around this topic. That's a really great reason to reach out to our office and encourage that, to meet with one of our staff. Other things you'll note on this slide is that we do provide leadership trainings and group presentations. So if your student becomes involved in a student organization, they might see us in a capacity of leading a training for that group on a health or well-being topic. We have a peer education group on campus called the Wellness Educators. So if your student has a history of being a peer educator and they're interested in getting involved in that capacity on our campus, we would love to have them and just have them reach out to our office if they want to learn more. That'll be one way to, in the fall, that they'll get an opportunity to engage with their peers on these topics, because our wellness educators will bring information. Like one example is on sleep and how to get good quality sleep and enough sleep to help fuel your days here at Bentley. That is one thing that our wellness educators address in some of the programming that they do. So there's an example. And another piece to highlight on this slide is that we do offer a mindfulness and meditation skills-based class. That's 4 weeks for students to enroll in, that will be offered again in the fall. And we do offer weekly fitness and stress reduction classes as well. So this slide just highlights through pictures some of the programs that we offered last year on campus. So you'll see a variety of events ranging from things that are campus-wide, such as Consent Day, to the mindfulness and meditation skills-based class, is sort of smaller and group-based, to some of our student engagement opportunities with our wellness educators via our Instagram page, and then pop-ups that we host in the Student Center. Another activity to highlight is the Fall into Healthy Habits Challenge, where we partnered with Bentley Dining on this last year. We'll be offering that again. It's a great way as your student thinks about transitioning to try out some new habits, building habits while they're here at Bentley, and figuring out what some of the resources are to sustain those habits as well. And we have some great prizes we'll be giving away. So when we think about student well-being, we survey our students and we ask them, what's getting in the way of your academic success? What's coming up for you? And so our students tell us that stress, sleep difficulties, anxiety, illness of some kind, so flu, cold, or sore throat, work, and overcommitment contribute to that sort of disruption of their academics. So since we know that, when we ask our students this question, when we think about this transition to being here at Bentley, we want our students to kind of have this conversation or thought process for themselves about how do they address stress for themselves when they're feeling overwhelmed. What are the things that they turn to de-stress, to relax? What resources do they have? Who are the people in their lives, such as parents, family members, that they turn to for that social connection, for that relationship piece, to kind of help feel supported? So that's where that family piece kind of comes in as well. And also just navigating some of these new situations. Another thing that's up there with the sleep piece is knowing that the student's going to be in a different environment sleeping, and they're going to have a roommate, and how do they have that conversation with their roommates? That might be something you talk through together, like, oh, what are some things that I might need to consider once I get to campus? And then also encouraging your student to get involved, and many of the organizations, we have a really vibrant student life here, and there are lots of ways that students can get involved and create social connections. I think what's really important to remember is that this does take time, and it is a transition. So it's very exciting, but to remember that some of these pieces may not fall into place right away, and that there might be some trial and error as well, and to certainly utilize the resources from our 3 areas in kind of navigating when things maybe aren't going as well as a student might hoped, and then also noticing when things are going well as well. So just in closing for the presentation portion, just knowing you can find more information about our 3 areas on our web pages, as you see listed here. We do have an Instagram handle that you'll see listed at the bottom, Bentley_health, and we encourage your student to follow that Instagram page, because there's great information that comes out of there, and we'll communicate to the campus about our programs, events, ways to get involved, and just good health information as well. So in reminder, we have some upcoming deadlines for your student to be aware of too. As Margaret had already mentioned, through the health center, those immunization requirements being due July 1st, so that deadline is imminent. And then also the health insurance piece enrolling or waiving by August 1st. So that's a deadline, but you can do that anytime before then. And then from a wellness and health promotion perspective, your student will have 2 online education programs that they'll need to complete prior to move-in. So those will be alcohol EDU and sexual assault prevention online courses, and there'll be more information coming soon about those. So we'd like to thank you for listening in thus far and invite any questions that you have. We'd be happy to answer about anything we've talked about or anything that's on your mind.
Okay, so my name is Lauren. I work with orientation, and I'm going to be asking you all some frequently asked questions here. And just like they mentioned, feel free to use the chat box on your screen to submit any questions that you might have had during the presentation. So one question here says, I'm currently taking medication for ADHD. Are there people at Bentley who will be able to continue to prescribe my medication?
Mm-hmm. So that's a question that we get often, as many of the students who come in are on medication, have been on medication for a long time. And unfortunately, right now, we're not able to provide that service, but we do have a number of providers in the area who we are familiar with, and we can get somebody connected. There are also a number of states in which you are able to continue getting medication from a current provider. These are mostly sort of New England states or in the New England area. So I would check with your current provider and find out if that's something you're able to continue doing. Otherwise, we can be happy to assist in terms of finding somebody in the area.
Okay. Alrighty, so another question here is, where is the closest pharmacy that I can get my prescription filled?
Okay, I'm Margaret, I'll answer that one. So students use Osco Drug a lot on Trapella Road in Belmont, and the Bentley shuttle does go by there. It's located in the Star Market, so that's a very close one. It's less than 3 miles. There's also CVS on Linden Street is close by. We have a list of all the pharmacies on our website, so I would just recommend checking that out. We have a healthcare option sheet, which goes over all local healthcare resources.
Okay. So next question, does the health center administer allergy shots?
Yep, we do get a few phone calls over the summer on allergy shots, and we don't administer allergy shots in our office because we're really not prepared if there was a full code and student needed intubation and have that kind of emergency services right there. So we do have a list of local allergists in the area that we can refer you to that will administer them.
Okay, and I see a good question here. So this person's asking if the release waiver needed for health visits as well as mental health, if release waivers are needed for health visits as well as mental health visits, and if the students are offered that waiver upon a visit or if it's part of the orientation process.
So we don't have a waiver for health visits. It's, you know, if a parent wants to speak to us, they're welcome to call. And then as long as we have consent from your child, then we would be glad to talk to you. But it's usually just on a episodic visit type of situation, not a full blanket consent, unless your child is under the age of 18. That would be different, and we do have a form under the health center website as well as on the portal for parents to sign for emergency and mental health care for a child under the age of 18.
There you go. Okay, and then I see another question just popped up here. So this person is wondering if there's a time management class, so kind of balancing between football and classes, if there's anything offered along those lines.
That's a great question. So I think from wellness and health promotion perspective, this is a topic that comes up a lot when I talk to our students as a skill building piece. So we've definitely integrated it into some of our programming that we do. I wouldn't say there is a class per se that we cover specifics on time management. But if that's something that your student is struggling with and they want to come chat, or even just proactively come chat with someone in our office, we'd be happy to set up an appointment to talk about it.
That's great.
I'd like to just say something about that too.
Yeah.
Academic services on campus is a great resource for any kind of academic help. So I would definitely have your son or daughter reach out to them because they will offer classes like that. So it would be a good resource.
Mm-hmm. Okay, so the next question is, where do I go for medical care when the health center is closed?
So I think I talked a little bit about that already. On campus, if 24/7 campus police are available and can transport students to the Newton Wellesley Urgent Care or to the Newton Wellesley Hospital. There are several urgent cares all through Waltham, so I would check with your insurance and find out, first of all, if Newton Wellesley Urgent Care is covered. I really like that one the best. So there's those options, and they are just a few miles away. So if it's the weekend and something minor, then and your insurance covers it, your student could take a Uber there. But again, we have the healthcare option sheet on our website that will list some of these resources. But just encourage your son or daughter to please come in to our office during the week, and as early as possible is the best thing to do and the cheapest.
Yes, and I also see on here too that first year seminar is also going to provide some support too for students, so that will be a helpful resource. Okay, and then I see another question here. If a student needs a TB screening.
Yeah, so there's a TB risk questionnaire on the portal that all students have to complete, that as well as their health history. And the TB risk questionnaire has 3 questions, and if you answer yes to any one of them, then you are deemed high risk and then need to see a medical provider and have the tuberculosis medical provider form filled out. So basically, if a student was born in any country other than the US, Canada, Australia, New Zealand, or a country in Western and Northern Europe, or has visited any of those countries for longer than a month, then they do need the TB screening blood test or the skin test. An X-ray alone is not adequate. And we will be checking students for this at check-in. The international students, we will be making sure that if they were born in any of the other, these countries, that we will be checking, and you will need to have the TB screening test done. And the provider has to fill out that form by steps. You have to have the step first, the blood test or the skin test, and then a chest x-ray. You can't just have the x-ray. That's step 3, which is has to be done second. All right, thank you. And please, that's really important. We are very concerned about TB in this country, and it's really important that you have that screening test if you are at high risk, because not only will it prevent you getting TB, but you can get some treatment here for it if you have latent TB, which is you've been exposed to TB but are not showing any symptoms of it.
That's great, thank you. So our next question is, what do I do if I'm having a health or psychological emergency?
So I probably the first thing is if it's an emergency, you could call campus police. They are certainly available 24/7 and would be able to help you in that sort of sense of an emergency. But if you are able to make it to the health center or to the counseling center, you can also go there and say that you're having an emergency and that you need to be with somebody right away. And the front desk there will know how to handle it and be able to connect you with somebody who will be able to see you as soon as possible.
Yeah, and I would just emphasize to have your student have the campus police number on their phone, 781-891-3131, because they don't want to call 911 on campus because the ambulance will not know where to go. By calling campus police can direct an ambulance to the exact location. So that's why it's good to call them.
Okay. So if I have food allergies, who do I contact at Bentley about that?
Okay. You would call the dining services manager, and I understand they're going through some transition now with staff, so I don't have the name of somebody. I do have the dietitian's name, Laura Klotz, Clotz. She is the dietitian. I would go to her first, and she'll explain to you what the Sodexo has for resources for students with allergies.
Okay, that's great. So another question about health and wellness. How would I go about getting involved in health and wellness?
So if you're interested in being a student leader in our area, well, I think there are a number of ways of getting involved. You can totally come out to some of our programs, see some of the things that we're doing. You can take advantage of our resources. And if you want to become a wellness educator, we do recruit wellness educators annually, and it is an academic year commitment. And if you are interested in working with us, I know first year students will have that group set, and your student was newly coming to campus, but if they're super eager to get involved, just reach out to me. I will find a way to get them connected to something that they're interested in and passionate about. We're really good at trying to support our students in whatever pursuit from that perspective so that they can get that experience.
Okay, and then I have one last question here on our frequently asked question list. If you all have any further questions, please feel free to send those in. We can answer those in our last remaining minutes here. So the last question that I have here, what kinds of fitness classes are available?
Oh, that's a really great question. So there's typically a notice that's sent out the beginning of each semester for registration for the fitness and stress reduction classes. So typically we'll have a variety of classes. So cardio, and there's Zumba classes, there's yoga classes, kind of an array. So I would say take a look at that notice when that goes out. Typically that comes from our director, Jessica Greer-Trawa. And the registration, there is some cost to it, and it is for residential students. It's actually in one of the first year residence halls is the studio in which the classes take place. So that's going to be in Slade. So there is some cost to it, but it's not too expensive, and that does kind of cover the whole semester typically of classes. Yeah.
Can I just say one thing that I forgot to mention? I did do a Zoom video for students and families and kind of walked people through the portal. So that is going to be going out on the student newsletter and the family bulletin. So if you want to look at that, that might be helpful for you. Mm-hmm. And then I just encourage you to have your student, look for the emails from the nurse. They'll be from the GA Health Center, to open those up and read them. She will notify students if they still need to complete certain requirements that weren't submitted. If a student has completed everything, they will not hear anything. So you don't need to call us and ask us if everything's in. I know that you want to get that answer and not have to worry about it, but we'll let you know if everything's not complete. So don't worry about that, and your student will get, so just to make sure they're looking out for those emails. And I just want to mention that if students haven't completed the requirements this year, there'll be a non-refundable fee applied after the first day of classes. This won't apply to students, though, that didn't have access to vaccines and had it to start series. As long as they've started the series, they wouldn't be penalized for that. But everyone should be completed with everything by early fall, and students will be put on a health hold and won't be able to register for classes if everything isn't complete either.
Okay, thank you. Thank you all for your time. This is great. We are going to wrap up. Please feel free to reach out to our office if you have any further questions or anything like that. And we look forward to seeing you all again soon. Thank you.
Thank you.
Thank you.
Thank you.